As you know, October is Breast Cancer Awareness Month, and Texas Oncology wants you to know how to detect the most common form of cancer in America, excluding skin cancers. Dr. Meghan Hansen is a breast surgeon at Texas Breast Specialists, and she joins me to share more. Good morning, doctor.
Thanks for having me, Jane. It's good to be here.
Great to see you. This is important information for women. What are the most common signs of breast cancer?
So what I would tell most women is that most women actually don't have a lot of signs related to breast cancer, and that's why screening mammograms are so important. We usually, we want to detect the cancer before you can feel it or before you have a sign. But if women do have symptoms and signs, usually it's a painless lump. It can be at or around the collarbone. Other signs could be, changes to their general breast, a nipple retraction, a rash, change in breast size, skin dimpling, things like that. So if you ever notice any change beyond your baseline, you would want to check with your primary doctor, your OB-GYN, and get that looked at.
So I just had my mammogram like a couple of weeks ago. Thank you. It was clear. Everything was good. But that's why screening is important, because a lot of the signs aren't apparent.
Yes, exactly.
Okay, so who should be screened for breast cancer? There's been some controversy about this.
And I completely agree with you. There are a lot of different bodies of guidelines that recommend screening, and ultimately it's going to be a very individualized answer for each patient. And it would be, between that patient and either their primary doctor or their OB-GYN. Women in their 20s and 30s, they can have a clinical breast exam, but if that patient themselves had an atypical finding or had a family history of breast cancer, other things, they may want to start screening early depending. The average patient, average risk is going to start somewhere between 40 to 45 years old. And then again, depending on different guidelines, this can include annual screening mammograms, sometimes biannual, but most of the guidelines will recommend doing them annually. But again, this is very individualized based on personal risk, family risk, and between that patient and their physician.
So it's my understanding that there was a huge drop-off in screenings during COVID. What about at this point? Should women be concerned about in-person screenings like mammograms?
No, I would encourage all women to go and get their screening mammogram. The imaging centers are taking every precaution possible with masks, social distancing, sanitizing to ensure that it is just as safe as any other place. And it is very important, like we were talking about, to get your screening mammograms. Even in my own personal practice, I've had a lot of patients not get their mammogram because of the COVID-19 pandemic, and patients are presenting with later stage breast cancer, which does make it, more involved with their treatment. And the earlier stage we catch it, the better patients do.
Okay, can't say that often enough. Thank you so much for being with us. How can viewers learn more about symptoms and screenings?
So, Texas Oncology does have a lot of great resources. You can go to their website to look for anything about screenings related to breast cancer, other things related to genetic testing, nutritional information. And of course, what we always encourage patients is to go to good, reputable websites, but Texas Oncology is definitely a good place to go.
Okay, thank you so much, doctor. Have a wonderful day.
You're welcome. Thank you.
If you have a higher risk for breast cancer due to factors like age, family history, talk to your doctor. Visit texasoncology.com to learn a whole lot more.